Getting diagnosed with a life-threatening disease can be very traumatic. You may feel overwhelmed, alone, and hopeless. Dr. Triple O of Triple O Medical Services understands how difficult this may be for you and your family. He and his team are here to hold your hand from diagnosis all the way through treatment. Triple O Medical Services offers a wide range of services in infectious diseases, including HIV and hepatitis management, wound infections, clinical trials, and wellness services. Triple O Medical combines medical care with research in order to bring you the best and latest treatment options. Call 561-832-6770 for more details. Visit triple-o-medical.com.
Welcome to drtriple-o.com. My name is Dr. Triple O. Today's show is about living with chronic hepatitis C. Hepatitis C is a very common infection worldwide. In this country, United States of America, it is the most common cause of liver transplantation. For years, the treatment has been poor, and the side effects of this treatment has been horrendous, horrible, and most people could not tolerate the treatment. And the cure rate has been very low, to say the least. Nowadays, in the last couple of years, the treatment has been incredibly better with little or no side effects. The duration of therapy is very short, and so most people are doing great, and it can kill most people. So today, we're going to be talking about hepatitis C with someone who is living this, who went through this, who is currently infected and getting treatment. She went through the old treatment and currently the new treatment. So we're going to hear from Marie, her perspective on chronic hepatitis C, what she has to go through, what she has to endure, and where she goes from here. Thank you for joining us today. We'll be back in a few minutes.
Getting diagnosed with a life-threatening disease can be very traumatic. You may feel overwhelmed, alone, and hopeless. Dr. Triple O of Triple O Medical Services understands how difficult this may be for you and your family. He and his team are here to hold your hand from diagnosis all the way through treatment. Triple O Medical Services offers a wide range of services in infectious diseases, including HIV and hepatitis management, wound infections, clinical trials, and wellness services. Triple O Medical combines medical care with research in order to bring you the best and latest treatment options. Call 561-832-6770 for more details. Visit triple-o-medical.com.
Welcome back. Again, thank you, Marie, for being here today. What we're talking about is hepatitis C. How do you get it? You get it through piercing, tattoos, IV drug use, using cocaine through the nose, blood transfusion, or through organ donation if it's infected. Those are some ways of getting hepatitis C. You have hepatitis C and you're living with this. Can you share with us how you think you contracted hepatitis C?
Personally, I think I contracted hepatitis C from sharing needles with my ex-husband. And unfortunately, he's not here to talk about it. He's not even living anymore because he contracted something else from that.
Okay. And thank you for sharing that with us. The part of the problem is most people who have hepatitis C they don't even know they have it because only 15 to 25% of people have symptoms. Actually, let me take that back. Most people don't know they have symptoms. 70 to 80% of people don't have symptoms when they have it. Only about 10 to 20%, about 20 to 30% may have symptoms. And the symptoms are very non-specific. You have fever, nausea,
Night sweats.
night sweats, joint pain, jaundice. These are very non-specific symptoms. So most people may have it and not even realize it, and they get better. And so they don't even know it. Or those people who have it, about 15 to 25% will actually clear the virus. About 75 to 85% will develop chronic infection. And some of those people may have fatigue, and they might think, I'm just getting older, so I don't really think I have it. At what point did you think that when did you find out, compared to when you think you may have been infected?
I found out that I had hepatitis C in 1990 when I went to an alcohol rehabilitation program. And they did blood work on me anyway. And when they came back and told me that I had hepatitis C, I was in shock because I'm like, how did I get that? And is there a cure? They said, no, there is no cure for that. You have to live with it. And then, I was faced with, the fact that you cannot drink when you have hepatitis. And you cannot, go out and, without and not take care of yourself. You can't do that because even though you don't have any symptoms, so you think, sooner or later, it's like a silent killer. It eats away at your immune system so that no matter what you get, it ends up being chronic rather than just being symptomatic.
Most people who develop this chronic infection are not aware that they have an infection going on in their body. They just don't know.
I lived with that for 27 years.
Absolutely. And it can take about up to 30 years from the time when you get infected to when you get cirrhosis of the liver.
That's right.
And that's when people may find that they have it. And once you get cirrhosis of the liver, which means your liver becomes shrunken, becomes small and hard. And then all that blood flow that's supposed to go to your liver, to your heart, becomes pretty much you get backed up.
Right.
So you get all this sweating on your legs, on your belly.
You're very right about that, and I couldn't understand why my hair was falling out as well. This swelling, and then sometimes nausea, and then sometimes where I felt like I had flu-like symptoms. Night sweats, like I had mentioned before. Also, a change in my metabolism seemed to. I went from somebody with a hyperthyroid problem to being hypo. And I don't know, maybe I'm not a doctor, but I can assume that may.
Yeah, most people feel kind of fatigued with their symptoms. So I think that's probably what you were feeling.
Mm-hmm.
And as I was saying before,
I was gaining weight.
As I was saying before, when you have that cirrhosis, some of those patients then develop cancer of the liver.
Mm-hmm.
And that's the reason why it's important to try to treat. Unfortunately, we didn't have good treatment prior to all this. And I'm sure you're aware of that because I think you went through previous treatment before.
Oh my goodness.
And I will ask you in a few minutes your experience with that treatment.
Mm-hmm.
In the old days, and when I say old days, I meant
90s.
5 years, 7 years ago, the only treatment you had was interferon, which is an injection, and ribavirin. And that carries with it a lot of side effects. And the treatment was not very effective. Maybe 40% of people at the best would get cured. And we would treat them for a year, 2 years, and they went through a lot. Before I go into some of those side effects, I want to hear what you have to say, what your experience was with that treatment.
Okay, well, I had to take 4 ribavirin pills in the morning and 4 at night. And as far as the interferon injections, I had to inject myself every other day on a part of my body around the hip area. One day I'd have to do it on one side, and then wait a day, and then the next day after that do it on the other side. I couldn't stick myself in the same place twice. They asked you to rotate it.
And what kind of symptoms did you have? How did it make you feel?
Yeah, depression, long periods of fatigue. I had to use Rogaine for women at the time because my hair was really thinning out to the point where you could see it. I looked like I was about 80 years old, you know, and nausea, and for some people, I don't know, it kind of made me feel like suicidal a little bit, because like I took it for 9 months, but I felt like I was aging in the 9 months rather than healing.
Absolutely. And that's, you mentioned suicidal attempt or suicidal ideation. That's actually very common. Usually, before we put people on that treatment, we have to make sure they don't have depression that's uncontrolled. Because if they have uncontrolled depression, you put them on that medication, they could actually try to commit suicide.
That's
So
right.
That's it. You know, those are the serious side effects. I mean, people have mood changes. They snap easily, and even with that, you mentioned you took it for 9 months, and people took it for 2 years, and still they were not cured.
Yeah, that's the thing. When I was, the doctor that had prescribed that to me told me that it was a 70-30 chance that I would be cured, and that was in 1994 in West Virginia. I found out I had it in 1990, but I didn't do anything about it, or try to do anything about it until 1994, because I was in denial. I couldn't believe that I had this.
When you went through the 9 months of therapy, were you cured at the time? Or did they tell you that the virus was cleared?
My count was lower, and almost to the point where it was like 38 was instead of 32. It went, you know, it was 38. That was a number I remember. However, no, I was not cured. He told me it was in remission and it would come back.
Okay.
And I was very upset.
And I think that's some of the things that we need to share with our audience. When you treat hepatitis C, especially in the old days, you can clear the virus in some patients, but the virus will come back.
And that's exactly what happened.
And we call that relapse.
Exactly.
Then you have people who you treated who would not respond at all.
Right.
And we call those non-responders. And you have people who responded partially. You knock the virus down a little bit, but not all the way.
Right.
And the success rate was not very good. And with all the side effects that you mentioned, it's very incredible that people couldn't even finish the duration of the therapy because they were having so much problems. Now, having said all that, things have changed. In the last couple of years, last 2 years, we've had better therapy. Now, interferon is no longer something we even talk about. Now we have medication that are all pills and only for 12 weeks. In fact, in some situations, 8 weeks.
Really?
So, can you tell us, I'm sure right now you're on treatment again. The treatment you're taking right now, does that involve the interferon or not?
No,
Okay.
it does not.
And how many pills are you taking?
1 pill.
Just 1 pill a day?
Yes, sir.
Wow. Isn't that, I mean, what kind of side effects are you getting from this 1 pill?
The only side effects that I've experienced is profuse sweating, especially at night. When I, you know, like I said, I'm not a doctor, but I can tell you this much: it's comparable to that of sweating out a flu virus.
Wow.
When you're sweating out, you sweat. I feel like I'm sweating out toxins that my body has been suppressing for 27 years.
And how long is this treatment supposed to last?
This treatment is a 3-month treatment, and it's supposed to last as long as you don't go back to the lifestyle that you had when you got it.
Now, if you were to compare the symptoms you have now of the sweating compared to what you went through with interferon, how will you compare the two?
The only problem, like I said, the only problem that I ran into with this new treatment is the profuse sweating. Aside from that, I feel like I'm 23 years old again. However, with the interferon, you feel sluggish, and no matter what you do, you can't lose weight. Like, you'll gain some weight, like you'll be like swollen. And no matter what you do, you can't, you know, your hair will fall out, you will swell up in some cases. I mean, in my case, I did. I can't speak for everybody. But also, you may develop thyroid problems. You know, you may develop glandular problems, like, you know, or problems with your lymph nodes. You know, I'm not a doctor, but I noticed a significant change in those body functions of mine while I was on that.
Wow, that's incredible. It's incredible that you went through so much for 9 months and you couldn't get rid of the virus.
Mm-hmm.
Now you have a better treatment now that you only need for 12 weeks, and you have a better chance of actually clearing the virus for good. With the new therapy that we have now, the success rate ranges between 95 to almost 100%, depending on what drug or what treatment you take and what type of hepatitis C you have, which is so amazing. Now, I also want to mention that there are actually like about 6 different strains of the virus. So you have 1, 2, 3, 4, 5, 6. One being the most common in this country. What strain do you have?
As far as I know, I have genotype B.
1B, right?
Mm-hmm.
Okay. So 1B, the most common. You have 1A, 1B, and you also have 2A, 2B. So these are the various type of strains that you have. But again, in the last year or so, or 2 years, the treatment has really been amazing. And there are more treatment coming out in the pipeline that are just as good, if not even better. So it's so amazing that we can actually do something about a virus that has been really causing so much, so much morbidity and mortality for so many years. And,
Right.
I'm hoping that this will transcend to other viruses. The other thing I would like to share with the audience, if I may, is things you could do if you have hepatitis C at home. I may just ask Maria for a second. How did your family members or your friends treat you during that process, during that period when you were going through your treatment?
Well, in some cases, people treated me like I had the plague or something, and, if you do live around anybody that has the HCV virus, it's good never to use their toothbrush, never share toothbrushes, never share deodorant, never share razors, never share nail clippers, anything like that. Eating utensils, without washing them, because the hepatitis C virus can live outside of the body for a significant period of time, long enough where somebody else can come along and pick it up just as easily.
That's an excellent point you made. Thank you, Mary, for saying that. Yeah, the hepatitis C virus can last on the surfaces for between 16 hours to 4 days in room temperature. So it clearly can survive outside of the body for several days. So what she said was very important because, I tell my patients this all the time. When you have chronic hepatitis C, if you have children in the house, sometimes your children will take a razor and they want to shave because they see Papa, shaving and they think it's cute. My daughter did that one time, and then she caught herself trying to shave. So I think it's important to hide your razors so that you don't have your children get hepatitis C by playing with your razor. Even friends, if you're in college, don't let your friends share the razor to shave their legs. Toothbrushes, like she mentioned. So those are very key things that people who live with hepatitis C has to be aware of and talk to their family about. Anytime you have any chronic disease, I think it's always a great idea to sit down with your family members and educate them on what you're going through, so they can be supportive. The more they know about the disease, the more supportive they can be. And that's what Maria just alluded to a few minutes ago. Now, what's in the future? Obviously, the future is, there's good treatment right now. There's better treatment. There's better treatment coming in the future. You don't know if you have chronic hepatitis C until you get tested. Most of the time you go to the doctor, you go, I've been tested, I was tested for everything. That's not necessarily true. Hepatitis C is not one of those tests that they do routinely. You have to request for it. So if you're a baby boomer, get tested. Anyone that with risk factors such as cocaine use, IV drug use, sharing needles, piercing, tattoos in an unhealthy environment, you should have your doctor test you. If you're a man having sex with men, you should also get tested. So get tested specifically for hepatitis C. And once you get tested, there are other tests to do to confirm that, because you may, even if you test positive, you may be one of those people that may have cleared the virus. So additional testing may be required. So inquire from your doctor, talk to your doctor, and make sure the appropriate test is done. Now we're gonna take a short break. Thank you.
Getting diagnosed with a life-threatening disease can be very traumatic. You may feel overwhelmed, alone, and hopeless. Dr. Triple O of Triple O Medical Services understands how difficult this may be for you and your family. He and his team are here to hold your hand from diagnosis all the way through treatment. Triple O Medical Services offers a wide range of services in infectious diseases, including HIV and hepatitis management, wound infections, clinical trials, and wellness services. Triple O Medical combines medical care with research in order to bring you the best and latest treatment options. Call 561-832-6770 for more details. Visit triplomedical.com.
Welcome back. Prior to the break, I mentioned the future of hepatitis C treatment. When we look historically, if we go back during the interferon Bavarian days, we treated people for 1 year, 2 years, trying to clear this virus. We were not very successful, and with that, we had so much side effects. Now we went through a phase 2 or 3 years ago where we're using 3 drugs, still including interferon, for 6 months or so, and people were still having side effects, but we had better clearance of the virus. So more people were able to clear the virus. And then currently we have treatment that are only for 12 weeks, and in some situations 8 weeks, and we're able to clear the virus in most people. Now the future is such that we are looking to treat people for 8 weeks, 4 weeks. Some of this treatment, the goal is to treat for only 4 weeks and clear the virus completely. And that's the future. There's no vaccine for hepatitis C, so there's no way to prevent that through the vaccine. But the good news, we can actually clear the virus if you do get it. Now, having said that, there are other areas I want to kind of talk about in terms of passing on hepatitis C. People who work in the healthcare field, if they get needle stick, they can contract hepatitis C. Sexually, you can contract hepatitis C. The risk is low, but it can happen. And if you have multiple sexual partners, your risk is higher than if you just have one partner. You cannot transmit hepatitis C through breastfeeding, but so these are the areas we want to make sure that we focus on also. Sometimes people think I use cocaine, I can't get hepatitis C. Well, when you use a straw to sniff cocaine, you can have bleeding, and when you share that straw, that blood then gets passed on to the next person with the hepatitis C. So that's how this happens. So even though you don't use syringes or needles, the straw becomes the mechanism by which you can transmit that hepatitis C virus. So the use of condom or protection for any infectious for sexually transmitted disease is very important. And the other thing I also remind my patients is that, you know, if you have John and Pete, they always hang out when there's a football game, because they both love football game. So when you see John, you're always gonna see Pete. So the same thing happens with sexually transmitted diseases. Gonorrhea, chlamydia, HIV, hepatitis C, all these things hang together. So it's not uncommon if you have one infection, it's not uncommon to have contracted another of those other STDs, because they like to hang out together, as I call them. So when you get diagnosed with one of those, you should be screened for the rest of these diseases,
Right.
because they like to hang out together. So Marie, in terms of what you've gone through, knowing other friends or people that may have hepatitis C, what can you say to them to encourage them to go for treatment, knowing what you know now?
Knowing what I know now, I can encourage people that, I would like to be able to encourage people that have contracted this hepatitis C virus to stop drinking if you're drinking. That's first and foremost. Don't take any Tylenol or Tylenol-based, as in acetaminophen type cold remedies, or like headache pills, like that's extremely bad for you. Anything with Tylenol will eat up your liver when you have this hepatitis C problem. Illicit street drugs, of course, you know that's no good. Let's see. Also, don't use, you're also not supposed to use antifungal nail, like Lamisil and stuff like that. It says that it can harm your liver. Believe it or not, the ointment can harm your liver.
I think you're absolutely right.
Also acetone from
Yeah.
nail polish.
I think what Marie is essentially saying is any drug that can be metabolized by your liver, it can be a potential problem if you already have hepatitis C. It's almost like you have a fire burning and you pour gasoline into it.
Right.
It's going to burn some more. So anything that goes to your liver can speed up the damage to that liver. So you always want to speak to your doctor and ask if any medication you're about to take is appropriate when you have hepatitis C. Now, for those that in the past, some patients didn't want to go for treatment because they were afraid of the side effects of the treatment. Do you think, in your opinion, in your experience out there, do you think that opinion has changed? Are people more likely to go for treatment now, or are they still afraid?
A lot of people are in denial. I know a few people that, they say, well, I have, the hepatitis C, it shows up in the antibodies, but I don't have it. Now, if you have the antibodies, you have it. You may just be a carrier, and maybe it's benign at that time, but you still have it. So it's always best to, follow up with a gastroenterologist or an infectious disease doctor and your primary care physician and get to the bottom of the problem before it's too late. Because they call this a silent killer for the simple reason that you can live for years without even knowing that you have it. And if you don't request a test for the blood screen, you won't get it. They don't do it automatically. It's something that you have to request.
All right. I'm going to try to summarize some of these things that we've talked about in those short segments. One is, how do you get hepatitis C? Well, we talked about that is through sharing needles or syringes, using dermal needles to do tattoos or piercing,
Sharing the same inkwell.
and using IV drug, heroin, using cocaine through straws, blood transfusion in some countries, not necessarily here, sharing razors, sex. So these are several ways you can get it. Now, once you get it, the next step will be, how do you diagnose it? And I think everybody should be tested at least once. If you've never been tested for hepatitis C at any point in your life, you should request a test to be done by your doctor, just to have some baseline. Know what your status is. If you're negative, great. If you are engaging in factors that put you at risk for it, then you should be retested on a routine basis, maybe on a yearly basis or every 6 months based on the risk that you undertake. So if you're negative but you constantly go out there and still share needles, or you're still using cocaine through a straw, then you should be tested, more often. But the best thing is not to do those things. Doing those things and getting tested is really not preventing the problem. So now, assuming that you have it, then you need to seek treatment. Like Marie went through years ago, the treatment was terrible. The treatment are much better now. They're more effective, less side effects, safer regimen. The duration is very short, 12 weeks, you're done. So I really encourage everyone out there who may have hepatitis C. Years ago, you've heard stories about how the treatment was so bad. The treatment is not what it used to be. It's much better. I encourage you to at least go in and get the information. Talk to your doctor, get more information, go online, look at the information, read about it yourself, and so you can see what options are available. The options are so much better. The drugs are extremely expensive. They range between $98,000 to $125,000. But don't let that stop you, because there are several options for you out there. I mean, sometimes there's drug assistance program. So go seek that help, because it's important. And like Marie said a few minutes ago, if you have it, do not do anything to make this condition worse. Don't ingest things that can damage your liver. Don't drink alcohol. Those things go to your liver. They'll cause damage. It's not common also when you have hepatitis C to have HIV infection. So people have co-infection. The risk of the damage to the liver is also progresses faster. But again, we can treat the hepatitis C and the HIV. So you should always be tested for all these things. And there is no reason why you should delay treatment at this point, because we have better options. We'll take a short
Getting
break again.
diagnosed with a life-threatening disease can be very traumatic. You may feel overwhelmed, alone, and hopeless. Dr. Triple O of Triple O Medical Services understands how difficult this may be for you and your family. He and his team are here to hold your hand from diagnosis all the way through treatment. Triple O Medical Services offers a wide range of services in infectious diseases, including HIV and hepatitis management, wound infections, clinical trials, and wellness services. Triple O Medical combines medical care with research in order to bring you the best and latest treatment options. Call 561-832-6770 for more details. Visit triplomedical.com.
Welcome back. I'd like to thank Marie for joining us today. You've done an excellent job. I really appreciate you coming today and sharing what you've gone through with the audience, and hopefully your experience will encourage other folks to come forward and get treatment and get better.
Absolutely.
Is there anything you want to say before we end this program today?
To everybody and anybody out there listening, hepatitis C virus is nothing to play with. And I'm going to tell you, they call it a silent killer for the very reason that it really has no specific symptoms. Therefore, I urge anybody and everybody to make sure that they ask their primary care physician to test them for that, because they don't automatically do it in a collected blood count that you get. So I advise everybody that hears me speaking to please, if they haven't already, get tested, because it can make a difference between a long life or a short life.
Thank you very much, Mary. On that note, I'd like to encourage everyone to listen to us on the Blog Talk Radio on Fridays from 11 a.m. till 12 noon. If you can't reach us live on Blog Talk Radio, you can reach us on the website, drtripleo.com. Drtripleo.com is spelled DOCTORTRIPLEO.com. You can also send questions on a bulletin board, and we can answer some of those questions at the next show. Remember, live, love, life. Until next time, goodbye.
I'll be 50 in 2 weeks.
Girl, you're like 25, so that's a blessing.
Well, you know what it is? It's called, when I first came to Dr. O, I looked like I was about 50. And now,
You look young. Everybody tells you, right?
yeah, because he healed me from, I was sick for 27 years. I had that for 27 years. Yeah, since I was 23. So,
Yeah.
and I had to change my whole style of life, my whole mindset, my whole social life, everything.
Yeah. It's a new
Because-
discipline.
Absolutely. And I got saved, and it made a difference for me.
God bless you, man. It's
Yeah.
a beautiful thing.
And I've also told many people in my day, when I first got that, I told everybody I had it, and they treated me like a plague, but I didn't care, because I didn't want anybody to catch it from me. Because how would I like it if somebody didn't tell me if they had HIV or HCV? And guess what? My second husband I was so naive. I married him when I was 22. He was a commercial fisherman. And I didn't understand what he meant when he was talking about cabin boys and stuff like that. Well, it turned out he was a macho man, but it turned out he was bisexual. He was also an IV drug user. I had no idea because he didn't look like one. He was a maintainer. He was 12 years older than me. He was handsome. I didn't know any better. Well, he wasn't so attractive when I looked at his pictures the other day and reviewed my past. I said, oh my goodness, I was with that. I must have had something wrong with me.
Yeah.
I'm going back to 1988. Well, he told me he had hepatitis C. He didn't call it C though, we called it non-A, non-B. He said he had that, but he was cured. And that it wasn't really anything. Oh yeah, well, baloney. Because when I found out that he was doing, I didn't find out he was doing intravenous drugs until after we got married. And we were on our honeymoon, and he's like, well, honey, I gotta do this. And I said, oh, can I try it? Duh. So I tried it. But I shared his needle. And so I got it. Boom. There's your hepatitis C.
Yeah.
However, he looked for me for 3 years after we split up, and he couldn't find me because he was a psycho, that type. If I can't have you, nobody can have you type. Very dangerous. Well, he couldn't find me because I had moved on to West Virginia. And so who's going to look for a New Yorker in West Virginia? That's not possible, usually.
Yeah.
Not from Long Island. Locust Valley, Long Island is not going to go to West Virginia. So I threw him off completely. Well, he committed suicide. He blew his brains out 3 years later with his dad's gun. Unfortunately, they cut the death certificate, the bottom off of it. So my mother, being a malpractice attorney at the time, had looked into that, and she said that was because he had contracted HIV. And he died as a result of that, and he was dying of that, and he committed suicide, because he didn't want to suffer anymore. Now, that's quite shocking. I'll never mention his name, of course, but that's quite shocking. And I'm so glad that we split up before, because he would have infected me with that too. So, it was that bad. And who, him? He didn't look like he was sick. Oh yeah, well, evidently.
Yeah, that's the problem. People don't.
You can't tell.
Yeah.
And it's like I keep telling people, you can get hepatitis C from sex too. And they're like, how? If it's blood-borne? Well, some women are cleaner than others. I'll leave it at that.
That's great insight, you know.
Well, you know, it's the blood contact thing,
Yeah.
and you know I don't need to go any further. Ladies, you know exactly where I'm coming from.
Getting diagnosed with a life-threatening disease can be very traumatic. You may feel overwhelmed, alone, and hopeless. Dr. O of O Medical Services understands how difficult this may be for you and your family. He and his team are here to hold your hand from diagnosis all the way through treatment. O Medical Services offers a wide range of services in infectious diseases, including HIV and hepatitis management, wound infections, clinical trials, and wellness services. O Medical combines medical care with research in order to bring you the best and latest treatment options. Call 561-832-6770 for more details. Visit OOMedical.com.